Lata Bhoir, an Associate Professor in Surgery at Vijay Government Medical College, Pune. Today we will be talking on cervical cancer. Cervical cancer is the second most common cancer of all the cancers in the world and is the leading cause of morbidity and mortality in women. Around 12,000 new cases are diagnosed in India of cervical cancer. Out of this, more than 30% die within a year. What is cervix? Cervix is the neck or the mouth of the womb. So cancerous growth or lesion in the cervix is called as cervical cancer. The most common cause of cervical cancer is HPV virus, that is human papilloma virus. Infection of this human papilloma virus comes from it is transmitted sexually and is the most common cause for having cervical cancer. The second most commonest risk factor is inflammation and infection. Chronic inflammation and infection of cervix gives rise to cervical cancer in future. So, timely diagnosis and treatment of this infection or inflammation may withhold you from getting cervical cancer. The third most common risk factor is having multiple sexual partners. This not only makes you a risk for getting sexually transmitted diseases, but also can lead to cervical cancers. The fourth risk factor, which is indirect risk factor, is smoking and drinking, alcoholism. Bleeding between periods is an alarming sign. So whenever you get bleeding per vaginally in between two of your periods, consult your gynecologist immediately. Or you may sometimes get bleeding after intercourse, or the intercourse may be painful. These are also very alarming signs and you should consult a gynecologist. Or even bleeding in a post-menopausal woman. A woman who has achieved menopause but suddenly gets per vaginal bleeding has to be seen by a gynecologist immediately and to be diagnosed or ruled out cervical cancer. Your gynecologist will perform a procedure called as biopsy. He or she will take a piece of the lesion of your cervix directly under direct vision or with the help of a colposcope, that is a scope, a camera instrument which has camera at this other end, which gives you a better visualization of your cervix, and through this you can get biopsy done. Then you are also subjected to CT scan. This CT scan is helpful to know for the staging of cervical cancer. Staging is the CT scan will tell you how much the cancer has spread from your cervix to the other organs of your body. The treatment basically depends upon the stage of your cervical cancer or the disease. According to the stages, the treatment can be surgery, radiation, or chemotherapy. In early stages, where the tumor is easily resectable or you can remove it easily without harming other organs of your body, the patient is subjected to surgery. A surgery called as Bernstein's hysterectomy is done. So after surgery, patients may be subjected to radiation. Radiotherapy is given to kill the cancerous cells which are left behind or which the surgeon is not able to remove because they are on some vital organs. The patient can also be subjected to chemotherapy along with radiation. Every female above the age of 35 years has to undergo vaccine screening every 3 years. Or patients or females who fall in a high risk group, they have to get a screen yearly. This will diagnose your cervical cancer early and get you treated early so that your outcome or morbidity and mortality is less. Then other measures for prevention is HPV vaccine. HPV vaccine to some extent can help you from getting cervical cancer. Then some lifestyle changes can help you in not getting cervical cancer, are having good hygiene practices, eating nutritious food, exercising daily, getting a break through your work, and also important is quit smoking